Now we're just going to run through doing a basic clinical exam on Star. First of all, we check the mucous membrane colour by lifting up the upper lip. You can also test the capillary refill time by gently pressing on the gum and seeing how long it takes for that colour to return. Next, we take the pulse using the facial artery. Don't worry too much, an awful lot of horses start chewing at this stage. If they do, then don't bother doing this part. Next, we take the heart rate. This is much more easily done if you have a stethoscope. You don't need a professional stethoscope like this, you can just get a cheap one, probably from Amazon or somewhere like that. What you do is you place the stethoscope behind the elbow, so really quite far forward. Don't be tempted to put it back here, you won't hear anything. So you push the stethoscope really quite far forward underneath the elbow. Once you've heard that familiar lub-dub of the heartbeat, you then listen for at least 30 seconds. Obviously multiply that by 2, that gives you the heart rate over a minute. Next we listen to the lungs. The easiest way to see if a horse is breathing is to stand facing the flank, and then you can gently watch as the belly moves with the breath. Horses are very subtle breathers, so it can be quite difficult to tell. So just spend some time just gently watching, and then your eye will pick up the movement of the belly. Horses only breathe at between 8 to 12 breaths per minute, so it's a very slow rate. Now we'll also take the lungs. They, again, are really quite far forward. The rib cage actually comes back to here, but the lungs themselves only really come up to this part here. So we listen in this region here. We're in top, middle and bottom. Next, we're going to take the temperature. Let the horse know that you're there and stand close to the hind leg. Don't be tempted to stand out here, and certainly don't be tempted to stand here. The closer you are, the safer you'll be. Reach over, take the tail and move it to one side. At this point, look at this leg to make sure that the horse is comfortable. Then insert the thermometer and then just gently angle. This is not a forceful movement, just gently angle. That means that the tip of the thermometer is touching the lining, and that means you're getting a true reading of the temperature. And the thermometer, certainly this model anyway, will beep when a stable temperature has been reached, which takes a long time. If you don't allow the thermometer to reach a stable temperature, your reading will be inaccurate. If you hear that beep now, it's now beeped. Gently withdraw the thermometer, let go of the tail and step forward away from the horse. And now you have a temperature.